of the muscular system. So this morning we're going to do the second part of some of the diseases that associate with muscle, and usually skeletal muscle. So these are really non-specific. They're not bacterial, viral. Most of them are sort of, I would say, idiopathic or miscellaneous. And the first one is called eosinophilic myositis, and we see that in cattle and sheep. We will also talk about a form of this disease in German Shepherds. For cattle and sheep, they don't know the etiology. They believe it's associated with a parasite. So most likely it's associated with a dead or dying sarcocyst. And so the interesting thing about it is when you look at the muscle, it has a green discoloration. So whenever you have an eosinophilic inflammation or eosinophilic reaction, it causes tissue to turn a green color. Obviously, you have to be careful between when we have degeneration of the muscle. Sometimes you do get a green coloration with some of it versus an eosinophilic myositis. When you expose it to for a long time to the air, it actually goes from a green color to an off-white discoloration. And again, this is not real. This is actually a fake piece of green meat. But to give you an idea of what green discoloration we're referring to. So that was the gross appearance. Histologically, we would expect to see, obviously, eosinophils. So you have a marked infiltrate of eosinophils, and you see areas of necrosis as well. They can form eosinophilic granulomas, and so that means you have both eosinophils and macrophages associated with those areas that are affected. It doesn't affect a specific muscle. It could be any muscle in the body, and that is affected by this eosinophilic myositis. So this is an H&E section of a muscle. So you see these are myofibers. Those are the ones remaining, are here, and move it here. These are undergoing degeneration. And we see tons of eosinophils, and we also have macrophages associated. So you have a sort of a mixed population, but the majority of the cells are going to be eosinophilic in nature. So the reason they think that it is due to a sarcocyst, a lot of times they do see sarcocyst present within the muscle. But personally, in my opinion, anytime I do a necropsy on a bovine and you look at a piece of muscle or you look at a piece of heart, we always find sarcocyst organisms just sitting around, hanging around. So is it really due to sarcocyst? Again, that's where the question mark is. Yes?
Did you identify the cells again?
Oh, sure. So I know, and this picture again, every time I look at pictures, I'm like, I can see where there could be some issues. So these are your eosinophils with the sort of eosinophilic or brightly pink granules. So these are all eosinophils. The other cells, it's hard to tell, but they're most likely macrophages associated with those eosinophils. The important thing, there are two things you should know about this slide, that you have necrosis or degeneration of the muscle fibers, and you have an eosinophilic infiltrate. Okay? This is actually a slide showing you a case with eosinophilic myositis, and as you can see, there's still some appearance, if you kind of squint your eyes, kind of looks somewhat green. But when it was as it's exposed to air, it has more of a white discoloration. So what do you think would be on your differential list for this picture? White muscle disease. So you really can't look at this and say, I definitely know this is eosinophilic myositis. I mean, you just can't. You'd have to look at it histologically to have a final diagnosis. And by the way, you all did, I mean, I don't want to speak, but this class did, I think, the best in the lab I've seen in forever. So I was glad to see that I really, when I tell you, you're going to diagnose it by looking at your gross and microscopic, that everyone was very familiar with the lesions, grossly and microscopically, and could come up with a diagnosis. So I don't think I've seen this many A's in a long time. Great job. Yeah. So that's eosinophilic myositis in cattle. We typically don't see too many clinical signs associated with it unless it's a large area of the muscle that's affected. So if it's like half of the limb, obviously you may have some sort of muscle issues, but typically it's something that we see on the necropsy floor. Okay, so the next disease is eosinophilic myositis, but we see this in the dog. It's also known as masticatory muscle myositis because it affects the muscles of mastication. So these are the muscles in the face that you use for eating. So we're looking at our temporal muscles, zygomatic, and masseter muscles. We consider it acute relapsing disease because they can have the disease and then it regresses. And then something happens, most likely a stressful event, and it happens again. So it's quite cyclical and sort of, it is on. And the breed that is affected with this disease, or most commonly affected, would be your German Shepherds. So what do you think these dogs would look like if they do present?
Droopy face.
Droopy face, yep, very good. What else?
The jaw anorexic.
Right, so their jaw will be sort of open, and when they're feeding, they have a hard time, moving their muscles. So difficulty eating, mouth held partially open. The mandibular area is immobile and sometimes swollen. So the disease can go from a phase of where acutely they start to have swelling of the face. And if it occurs more chronically, inflammation and necrosis leads to eventually atrophy of those muscles, and then you have indentation or sinking in of those muscles. So acutely, first it becomes swollen because it's inflamed, and then after a while it starts to atrophy, and then they start looking emaciated. So one of the things I want you to remember when you get into practice, that it's very important to look for muscle atrophy, especially in the face. That's one of the areas you can see them. Even on the head, you notice dogs, especially if they have wasting, or even they have this disease, eosinophilic myositis. So this is a dog with this disease, and can everyone see where the lesion is?
The temporals.
All right. So if we look here, and this is when you start looking at dogs and you look at muscle structure, that you really start to see indentation of the face, and when you have muscle loss and atrophy. So the owner may say, well, initially, they presented with clinical signs, her face was swollen, and then now as time has gone by, it starts to look more indented. And the owner may not notice that muscle loss. That's something people have a hard time seeing sometimes. So if the animal passes and we do a necropsy, what you typically see is a swollen edematous face, if that's the acute presentation. And the muscle may be dark red, doughy, or hard on palpation, and you'll see streaks of white streaks or yellow streaks in the muscle. And so what do you think those white streaks are? Necrosis, and then eventually fibrosis. So always remember, red is hemorrhage, and always some necrosis. White is going to be necrosis and fibrosis as it becomes more chronic. And when we look at it microscopically, as the name of the disease, we see predominantly eosinophils, and we may see plasma cells as well. And as it becomes more chronic, we see less eosinophils, more plasma cells, more fibrosis, and muscle atrophy and loss. So that's the acute phase versus the more chronic presentation. And again, this is a low magnification of a dog muscle with eosinophilic myositis. These are your myofibers right here. And these are all muscle fibers, and you have tons of eosinophils, sort of replacing anywhere that typically had muscle present. So again, I can give you a gross picture and give you a microscopic picture to help with your diagnosis. Any questions about eosinophilic myositis? I think they're similar in presentation in terms of what they look like grossly, but specifically for the dog, you have to know the breed specific and the acute presentation, and then later the most chronic presentation. Now we're going to talk about muscle dystrophies, or diseases that cause dystrophy in muscles, sort of wasting, degeneration. And the two that we're going to focus on will be white muscle disease, which I think you know already, and equine rhabdomyolysis, also known as what? You know
Monday morning sickness?
Monday morning sickness, or tying up disease. Yeah, yeah. Okay, so white muscle disease is commonly seen in calves and lambs, so we're looking at more of a ruminant presentation. There are similar diseases with other names in chickens. We'll talk about that next semester. And it can occur in other species, but this is the typical species we see it. They believe, and there have been many articles where there's still some controversy. They do know it's vitamin E for sure, and they still believe it's selenium, but there is some doubt in that. But for this class, the etiology would be a deficiency in both vitamin E and selenium. And so what's the function of vitamin E? Who takes vitamin E every morning? Anybody take vitamins at all? Heck, no?
When I remember.
Oh, Jesus. It must be an age thing. I take like 55, because I'm going to look like this at 7. What? But, okay, so why would, for the ones who do, anyone take vitamin E? Okay, no, you don't take vitamin E. Jacqueline, why do you take vitamin E?
Just in case I don't get the vitamin E from my food.
Very good. But what is vitamin E helping you with? Very good. So we are slowly dying. Do we know this? Like you're sitting here and your cells are just, yes, slowly fading into the abyss. So, and we produce oxidants, free radicals. And so your vitamin E is one of the antioxidants that will help with that. Y'all need to start taking care of ourselves, please. Please, yes. Randall, I'm not sure if you're asking a question. You're giving the fist bump. All right. Anybody else? Okay. So with this disease, you see striations. They're usually white and chalky, pale, inelastic, and dry within the muscles. Within the heart, we do see a very strange presentation where in lambs, it's usually seen in the right ventricle. Why? I have no idea. And in calves, we typically see the streaks in the left ventricle. So for whatever reason, there is a discrepancy or a difference between the two different species. So, can anybody tell me what kind of muscle this is? Okay, not tongue.
Spleen?
No, not spleen. Look at this right here.
Oh, sorry. This is my circle.
That's almost.
Not the tongue. Yes. So it's part of the heart. Very good. And I've done this class for 10 years, and the first answer is always tongue, which is a good. But let's look at it. So why did you say, who said endocardium? Why did you say endocardium?
I
Papillary muscles, yes. So this is kind of cheating. That's not fair. So this is a section of the heart in a ruminant. Doesn't matter which kind. And as you can see, the normal color is that more maroon color. You know, deep maroon color. But this is the abnormality. So when we look at it microscopically, we know that white muscle disease causes necrosis and fibrosis. So what would be your morphologic diagnosis for this? Fibrinonecrotic endocarditis. Very good. So the processes that occur will be necrosis of the muscle with secondary fibrosis. So that would be your morphologic diagnosis. And we say endocarditis because it's heart. Now I wouldn't give you a big piece of muscle like this and expect you to know that's heart. That's a little unfair. But even if you said myositis, that would be a correct answer as well. Did everybody get the morphologic diagnosis? Okay. Are we getting tired at the end of the semester? Yeah. I was like counting, I'm like a senior. How many more days until the end of the semester? We're gonna make it. So this is an HME section of muscle. And so on our first lecture, we talked about the changes that we see with muscle. So myocardial degeneration, we see hypercontraction of the muscle fibers. So for instance, let's see, here would be hypercontracted, it's very small. It's usually brightly eosinophilic, so we see that as well. What else did we say, if you can remember? We see fragmentation, so this would be a more normal kind of muscle. Here we have fragmentation, little breaks in the myofibers. So all of those things are seen with muscular necrosis and degeneration. Bless you. And this is a section from an equine, so they can also get white muscle disease, not as common as in our ruminants. And so do we think this is the lesion?
No.
Who said no? How could you say no? Well, you are correct. So this is not the lesion, this is just sort of fatty tissue. The lesion is right here. Those pale areas within the myofibers. And you can see it has sort of a pale, somewhat dry appearance. And again, we say morphologic diagnosis, severe diffuse necrotizing or fibronecrotic myositis. Again, same thing here. We do see a little bit of edema associated with this disease as well. With this picture, not this disease in general, but in this picture. So the pathophysiology, vitamin E and selenium protect cellular membranes from free radicals. And so some clinical signs, it all depends on what muscles are affected. If the heart muscles are affected, they're going to have sudden death. If it's the limbs, you may have stiffness, recumbency, and then eventually death as it spreads to other muscles. Or it affects other, not spreads, but affects other muscles. And we already talked about the changes you see with muscle necrosis and regeneration. All right, any questions about white muscle disease? That's kind of one that you always have in your back pocket as something you just remember. The next disease is equine rhabdomyolysis. As Christina said, it's also known as Monday morning disease, tying up disease. The more severe forms are Monday morning or paralytic myoglobinuria. So why do we call it Monday morning disease? Because you're lazy. Because they're lazy? What? No, wait a minute. I understand. It's Christina because they're lazy.
Because doesn't it occur after, like, a period of rest and then the diet's not restricted? So rest is like the weekend and then they're like, oh, it's Monday.
Exactly. So if, I always think of people like we run all week and then some people just kind of collapse in the weekends and then they start back again. That's probably very tiring. But for animals, it's usually for horses that are in race horses or ones that are performing for a long period of time and then they stop. They're not exercised, they're just kind of put away. They don't restrict their feed, so they eat whatever they want. And then Monday morning comes and then they present with this problem. They do feel also that animals who have vitamin E and selenium deficiency are predisposed to equine rhabdomyolysis. So clinical signs, you walk in the barn and they're sweating profusely. That is usually the first thing that the owner will see. They may have an elevated heart rate, they're very stiff and the muscles are swollen and board-like. And I'm sure Dr. Graham may have talked to you about this. They typically present with a myoglobinuria. So myoglobin being present in the urine. So how can you tell this is myoglobin versus hemoglobinuria? The color is one. So myoglobin has more of a brown tinge to it. And hemoglobin probably will have a more dark red tinge. But what else? Have y'all done urinary system yet?
We're going down.
Okay. Alright. So those are your typical presentations that you'd see with this disease. What would be on your differential list for any discoloration of the urine? Very good. Intravascular hemolysis. And why is that? So you have blood being destroyed